Rajput from Elets Technomedia. I'm the bureau head of Gujarat. आज के फायरसाइड चैट विद श्री के निराला जी के लिए मैं आपका स्वागत करती हूँ. Just to give you a brief about Elets. Elets is a 17-year-old media group working extensively in promoting ICT in India and across globe through its multiple channels. And one of them are our 4 magazines that we publish every month. That is eGov, which is the first monthly magazine in Asia on e-governance and smart cities. Second is eHealth, which is very relevant in the today's situation. Third is digital learning, that is based on education. And fourth one is BFSI, that is banking and finance service post. We also organize many conferences in India and abroad for the same. And we also have our online portals dealing in many sectors, and which is leading as one of the online portals. That is how during this lockdown, we thought to reach to you through this webinar and a fireside chat with all the senior government officials and top bureaucrats of various departments from various states. And that is how today we have our very own Shri Nirala ji, a 2005 batch IAS officer who has been working extensively whole day and whole night for his citizens of Ahmedabad district. He has been praised by many media channels for taking fast actions to resolve any issues coming up. It is truly our pleasure to have him today on our channel. And for this, we have a very well-known Dr. Ravi Gupta to moderate this session, who is the founder and CEO of Elets Online and also the editor-in-chief of our magazines. He is the man behind the success of this company. And because of him, today, Elets has become one of the leading organizations in doing webinars with all top bureaucrats. So here, I request Dr. Ravi Gupta to take over this session and to go ahead with this. Thank you so much.
Thank you, Hemangini. नमस्कार के निराला जी, आपका बहुत बहुत स्वागत है आज के वेबिनार इंटरेक्शन में.
थैंक यू.
नमस्कार. आज हम लोग इस चीज पर चर्चा कर रहे हैं कि कोविड-19 के बाद जो क्या-क्या कदम उठाए जा रहे हैं अहमदाबाद डिस्ट्रिक्ट में, और आप उस डिस्ट्रिक्ट के डिस्ट्रिक्ट कलेक्टर और डिस्ट्रिक्ट मजिस्ट्रेट हैं, तो क्या-क्या स्टेप्स हैं, क्या-क्या नए-नए इनोवेशंस हो रहे हैं टू कंट्रोल द कोविड-19 सिचुएशन. अगर एक बार इसके बारे में आप कुछ बताएं तो हम चर्चा को स्टार्ट करें.
So good morning to all listeners who are here with us. So the first thing as a district magistrate that I have to do to take care the health of our people, and health is right now the priority on all the priorities. First thing that I would like to tell you that this is one kind of disaster that we are going to manage with the help of government, with the help of society, and with the help of all political leaders, in fact, the doctors, scientists, anyone that you can say who can, help at any point of time. We are all getting the help from them, the first thing. The second thing is that the priority, there are so many priorities that one can have, but being a district collector, my priority is first to just handle this disaster smoothly, so that the death as well as, the life means what? Because being a member of the society, everyone there is a need of, the day-to-day, the milk, the medicines, and all these things. Apart from that, you need some medical emergencies also. तो पहली चीज जो मैं ये कहना चाहता हूँ कि being a district magistrate will have to take care of the need of our society. Being a lockdown, all we are now knowing that during this lockdown, many senior citizens, they are having a lot of difficulties regarding their regular medical checkup. The second thing that they are facing the difficulties that how they can get the regular supply of the essential items, essential goods that is needed for the day-to-day life. And the third thing that apart from all this, they are having the fear in the mind that how we can away from the infection of this COVID-19. So these few things that we have put in our priority, along with these guidelines of Government of India and Government of Gujarat, all we are trying to implement it, execute it very seriously and very effectively. That is our priority right now, first to handle this COVID-19 situations in our district, Ahmedabad.
Yeah. So, what are the steps, like if you can classify as pre-lockdown and post-lockdown, how has
Yes.
the responsibilities changed drastically?
Yes. Generally हम लोग देखते हैं कि being a human being, it's very difficult to restrict ourselves in a very defined area. We call it our home, flat, or whatever, the bungalow and all. We are habituated very much to go out from the home, like when we are going to the office, then we are having that kind of this habit to go to the office in the morning or come in the night or in the late evening. And the second thing that for a senior citizens also, they used to go for walk, or in fact the students, they are used to go to the college or schools. But all of a sudden when this lockdown came, so the life is become like a standstill, the first thing. So before lockdown that we can say that it was like there was no, having the meaning of how to live with this lockdown phase. But after this implementation of this lockdown, and all we are knowing that Ahmedabad is having more than 1.30 crores of this population, means 130 sorry 1 crore plus population in Ahmedabad. And all of a sudden when you are locked down, means everything or every activities that is seized, every activities that is paralyzed, except a few essential services that government has allowed to work. So it's very difficult to learn at that moment of time that how we can have in this time in our home. So the first thing is that before lockdown it was nothing. So after lockdown, what the experiences that we are now getting from our society members, that how we can manage the time. And the second thing is that how we can manage the fear. And the third thing is that apart from all these things, how we can away from this coronavirus infection. So that were the or in fact that are the most the difficult situations for our citizens here. And if you go to the city where the dense populations are there, where people are now hardly because our society, nature of the society in India is like that we are interacting with each other, we are interacting with the senior members of the family, we are sitting together, or we are going out just to have the leisure time, or we are going for the entertainment to watch the movie, or we are going to do the shopping in the mall. And also every activity right now, it is totally banned. So in that particular situation before lockdown, it was easy, and we were not knowing that how to have that kind of this life experience in that circumstances. Now everybody, they are now saying that yeah, we have to learn that kind of this life also, to live within a confined place, or within the a limited space in the home, or how to manage, or how to balance the relation among the family members. This is equally important. Along with all, we'll have to have the follow the guidelines, follow the lockdown policy or health protocols of the government. So that is the most important part that we can say during this lockdown.
So, as the additional responsibility of providing doorstep delivery of services, especially the essential items like the food and vegetables, has fallen on the government. So, how is that responsibility being looked after?
Uh, yes, during lockdown, it's very, very important for the government machineries to continue the smooth supply of the essential goods. because lockdown is a time where everyone, they are in their home. Everyone, they are now having the fear of getting the supply smoothly or not. So just fill the gap, or just to get rid of all kinds of the fears of our citizens, we have continued our essential commodities and services, because these essential commodities and services, definitely that can, give the good results to this lockdown. Because during the lockdown, the supply of milk, the supply of pharmaceutical products, the supply of all essential goods also, that will have to take care, and everything that we did it like that. During what we did, the first thing is that we have given lots of permissions to the essential goods and commodities. And the second thing is that the fear that was there in the supplier also, we have tried to, sort it out through the IC activities. We have taken lots of benefits of the social media, as well as the media persons. They are also cooperating very very nicely, that the government policy or the notifications, they have broadcasted it very well. They have explained through the learned persons. They have explained it through the government officials, and on the TV and the print media also. They have given this kind of this awareness to the people, that there is no dearth of supply regarding the essential goods and commodities. During the first few days of our lockdown, people were having the fear in their mind that maybe in the during lockdown we can't get the regular supply of the essential goods, so they are trying to just store in their houses. So the saw, the falls in the initial period, the rates, as well as the supply, that was that was not very smooth, that we can say. But when the people had this confidence that no, the government has maintained it well, there is no problem regarding the supply of essential commodities and goods. Now people are happy, and in fact the people, they are very very comfortable to not store that is not required for that. And because of this, administration has continued all kinds of this supply so well, that we have just saw this regain of their confidence of our citizens. And the second thing is that, because Gujarat is also, or in fact the Ahmedabad is also supplying a lot of raw materials, particularly for the essential commodities like pharmaceuticals, that we can say. So pharmaceuticals is having very very popular, or they have a very important place here at Ahmedabad for the production of medicines, manufacturing of medicines. And not even a single day that our pharmaceutical companies, they face that they had faced any kind of this difficulty in the in Ahmedabad. So right now the pharmaceutical companies, they were able to export also to the other countries also, like chloroquine is a very famous medicines that is used in COVID-19. In fact, US and other countries, they are also having a great demand of this SAQ. And in fact, the others like Amul Doodh, it has continued their production. It has continued their supply. In fact, the chemist shops, the Karyana shops, and everything, that they were running very smoothly. In fact, not only the hospitals, that we can say, the nurses, the movement of the paramedical staff, movement of the doctors, whether they are working in the government hospitals or the private hospitals, everything that was very very smooth. So because of this supply side, they can't having that kind of this problem during this lockdown, what we are now, still it is continuing up to the third. But people are, used to right now to live in this lockdown with the proper supply, with the proper need. In fact, the supply side is one thing, that we are daily using the food as well as the pharmaceutical products. But let us suppose if they have any kind of difficulty in Ahmedabad, many patients, they are having the regular dialysis, kidney dialysis. So initially they had some kind of this problem, but not only on the mobile, the mail, social media, and everything. Our systems were so active that even on a phone call, we had given the all kind of this facility for the kidney dialysis. We had given the facility for the health checkups to all beggars also. In fact, in the old age home also, we have provided the health checkup. We have provided the health checkups and the food supply to our migrant laborers. We have given the food packs and the food grains to our leprosy patients, where they will have that kind of this small colony. So all kinds of this need of this public or the citizens, we have tried to meet their demands. We had tried to, provide all kinds of this facility, that is minimum basic facility that we can say. So in this way, district administration had, it is continuing our efforts to reach up to the people.
Sir, how are you using social media and IT in this crisis?
Social media, because when we are having this habit to use Twitter, the Facebook, or the WhatsApp, and all these things, so everybody now they have the access to the Android or the iPhone, is it? And the second thing is that this is the best medium of communication. This is the best medium to do the IC activity, and this is the best medium to get the reactions of the general public through this social media. So social media has provided a very effective platforms to the government machinery to communicate their rules, regulations, as well as the new informations or new directions that is important, or that do or don't kind of this activities to the for the citizens. And the second thing is that let us suppose if we can have that kind of this guidelines that is printed in the newspaper, but many households, they are not getting the printed newspaper papers right now. They are using the e-edition of e-version of this newspaper also. And the second thing is that the followers, in fact, we are now seeing every user ID. Let us suppose we'll talk about the collector Ahmedabad Twitter handle. So initially, when we had started, it was around 10,000 followers were there. Right now, it is around 50,000 followers, because this is the best medium to communicate. That let us suppose what government is doing and what public is now facing, what public has any kind of this reactions. So through the two-way communications, the district administration is very comfortable to know the real mindset, or in fact the real comments of any kind of this facility or any kind of this guidelines or the notifications that we are regularly doing for this lockdown or for fighting against corona.
So, uh, Gujarat and especially Ahmedabad is known for a lot of diabetic patients uh, because of the cultural regions or historical regions. So, aren't they facing a lot of issues in this situation, and how are you helping them?
I can give you the data of this particular scenario. In Ahmedabad rural, there is 16 lakhs population, around 16 lakh population. And out of 16 lakh population, 3.59 lakh persons, they are categorized under vulnerable groups. In 3.59 vulnerable 59 lakhs vulnerable groups, we have categorized that how many of them are diabetic, how many of them are having the high BP, how many of them are the pregnant mothers, how many of them they are having the age of 0 to 5 years old, and the comorbid situations that they have. So what I did, the surveillance that I have done very effectively. So that was the experiment that we did in the Ahmedabad rural. There is the two parts in the Ahmedabad city and Ahmedabad rural. So what kind of the strategy that we did in Ahmedabad rural, the surveillance portion should not be suffered at any cost of time, any point of time. So now we are in this stage that we are doing the fourth round of this surveillance in the Ahmedabad rural, means the 16 lakh populations that they are now having getting the surveillance of fourth time, so that the persons who are having the comorbid situations, the person who is suffering, having the diabetic related symptoms, or having the high BP or something that kind of problem. So we are segregating them. We are segregating not through going to the household to household, but we are also in touch with them through the phone calls. Our paramedicals, our doctors, they are always calling on the routine basis. And because of this surveillance, because of this our segregation of those vulnerable groups, we were able to stop, or we can say that we have at least that we can say that we have controlled the figure that had not going very very up in the Ahmedabad rural. But there is a question in the Ahmedabad city also, because why the Ahmedabad city is having the figure very very high. So there are so many factors in the Ahmedabad city that we are now facing, because the population is very very dense there, and the awareness initially the people, they had not told about their travel history to our doctors, to our officials, and because of all these things, the time was lapsed, and the infections went into the another phases, and the community transmission that had started among the family, particularly where the walled city is there, because people, they have initially they had hesitated to narrated their travel history, and because of these things, when the community transmission has started, then the people they were having the problems. Then AMC started to take the action by giving by boosting the number of testing multifold. And because the number of samples that had been taken by AMC Ahmedabad Municipal Corporations manifold, uh, in fact more than 1,000 in a particular day. So the cases, the number of positive cases were increasing like anything. But we'll have to do it, because once we'll get the positive cases, then we'll do the required medical treatment to them, and we will be able to control this coronavirus as soon as possible. Without doing this testing, without knowing the positive symptom of this corona, it's very difficult sometimes to control the situation of this COVID-19 symptoms that is infected among our community.
What is the situation of testing? Like how much it is happening? How much it has speeded up now?
Earlier initial period, the testing kits were not easily available, but after efforts, government had imported many testing kits from other countries, and now Ahmedabad is also getting enough number of testing kits. And earlier we were doing the testing in hundreds. Now we are doing the testing in thousands. So now testing is not an issue, particularly for the city population, where the old city, old Ahmedabad, they are having a lot of infected people. Government has issued this notification. Government has given the support for the testing samples, whatever the that is needed. And the second thing that government has supported to the district is the testing lab facility that had now increased. The testing lab facility, earlier it was available in two places only in Gujarat. The first one is in the BJ Medical College, Ahmedabad, and second one in the Jamnagar. Right now in Ahmedabad, we have the testing facility in Civil Hospital Asarwa. We have the testing facility in Sola Civil Hospital. We have the testing in SPP Hospital, and one private lab, the Supratech lab. This is also the lab testing facility is available. In fact, not only this testing, in fact, government has taken a very good decisions, or in fact, because of this decision, that private hospitals, they can also treat the COVID patients or 3 hospitals already designated in Ahmedabad, that is SCG Hospital, Sterling Hospital, and Narayana. So these 3 hospitals, they are now treating the COVID patients. So those patients who are having the problem to go to the government hospital, government setup, they can get the treatment in the private hospital also. And the testing now we are also increasing in the rural population also, because in the rural population infections were not more well compared with the city population. So but right now, because the city people, they are also going towards the rural area, so the infection level or infected people, they are also there now. So government has given directions to test little more in the rural area, and we are now increasing the number of tests in the rural area also.
What is the status of number of beds available and number of quarantine isolation facilities in hospitals available?
Yes, yes. In civil hospital Asarwa, it is the biggest hospital we can say in Asia. Everyone they are knowing, and particularly for the COVID, there are 1,200 dedicated beds available for COVID. That is the achievement for the government of Gujarat, because a senior officers of ACS rank, Mr. Pankaj Kumar, he is taking care of this Asarwa hospital, particularly for the COVID related issues. And the second thing, in Sola Civil Hospital, they have also the 30 beds for critical isolation, and they can extend up to more than 200 beds, and the quarantine, it is more than 500 beds are available in the Sola Civil Hospital also. Similarly, in the SBP, that is run by the Ahmedabad Municipal Corporation, the ample number of beds are available. In fact, the Samras hostel, it is converted into the quarantine place. So overall, if you'll see in Ahmedabad, more than 5,000 beds are available for the COVID-19 patients. And now the private hospitals are also coming into this COVID patients treatment. So isolation as well as the quarantine beds are not an issue right now.
And what about the recovery of the patients? How much it is happening?
Yeah, after getting infected, the first fear factor is that what will happen in the family and the others, they have that kind of this havoc also. So the panic situations right now, it is going down. Earlier it was there that what will happen, but the death ratio is very, very less in comparison with the other countries. And the second thing that we can say that now the recovery ratio is going on increasing. Just yesterday that you might have heard the news from the Barodra that the 57 or more patients they have recovered, and the samples that they got it negative. Similarly, we have got the news from the Viramgam, that is the Taluka of Ahmedabad district. So the 47 samples, it is negative. So we are now saying, and the second thing is the persons who are admitted in the hospital, they are also now coming back with the total recovery, though they are having the age of 50 or in fact the 50 plus also. So the recovery ratio is now increasing because our doctors, our level of confidence, and in fact the precautions and the treatment is now settling at a very comfortable level. And our capacity building is also going on very, very the fast, and the paramedicals as well as the medicos, they are now learning how to treat all this COVID-19 patients. In fact, the facilities are also increasing, so that at a time that we can have that kind of the treatment we can provide to all COVID-19 patients. So recovery is not an issue. Recovery is very, very good. In fact, we can say that it is better than other states, because if we see the whole, the death in our, particularly in our district, so death ratio is very, very less. And particularly if you'll analyze the death ratio, then it's very, very, easy to analyze that the comorbid patients or the senior citizens, they are having more than one kind of the symptoms. Basically, they'll come, they become the sufferers of this COVID-19 little more, and sometimes they may our doctors, they are unable to recover their normal health. So in that situation, they face the problems.
And what is the
Otherwise,
situation of the PPEs, the production equipment for the doctors and the citizens?
yes, initially it was little difficult to get it. Right now, the numbers, it is comfortable and it is available. GMSCL is purchasing the PP kits and other related medical equipments for the Gujarat hospital. And the many private pharmaceutical industries, they are now come up with this new idea about the PP. And ICMR, they are now they are approving many agencies of this PP kit. And the many, in fact, the private agencies who are having a reach up to this PP kit, they are now donating also to the various hospitals. So PP kit is not an issue right now for our private hospitals as well as the government hospitals.
Now the government has issued some guidelines about opening up of the essential services, some of the factories and other services. So what's happening on that front?
Yeah, on 20th, Ahmedabad district, being a district state, we have issued a notification. And through this notification, more than 16,000 companies that is situated in Ahmedabad rural, in one go, through these notifications, we have given this permission to open. And out of 15 to 16,000 companies, almost 3,000 companies that they are under operation. Many good companies like Colgate and other big companies that it is started in Sanand and the other industrial area also. But they are facing little problem because this is the initial stage. What kind of problem that they are facing? The first problem that they are now facing, there are many laborers. If the companies are based on the physical laborers, so many laborers, they are not there inside this company. They might be, I mean, gone to their native place like Rajasthan, Bihar, UP, and the Odisha and other places. And the second issue that they are facing, let us suppose they have their, I mean, issue like the movement plan. Whatever the permission that we are issuing through the online, because we have the system of permission. There is a portal, digitalgujarat.gov.in, because Ahmedabad is a very big district regarding this population and area. So we have Ahmedabad is the first district to, I mean, do this online permission kind of this system. So the movement is another issue. But what kind of the movement that is needed, because most of the management staff, they are staying in Ahmedabad. So we have given the permission for the four wheels, and we have given the permission for buses also. So let us suppose the companies that their staff, they are staying in Ahmedabad, so they can deploy the buses. We are giving the permission to buses. We are not giving right now permissions to the two wheelers. Why? Because we'll have to have the main fight against corona. We'll have to have the effective, the measures that is supposed to take against the fight against this virus. So maybe a few companies that they have the sufferings, and many companies that they have the expectations to open the companies that is situated in the Ahmedabad Municipal Corporation and the municipalities area. In the government notifications, what I did, there is no, I mean, permissions that is given in the Ahmedabad Municipal Corporations area as well as the municipalities area where the companies will be open. No, because as per government notifications, we can't allow because of the fear that this number we don't want to increase. So let us suppose if the companies that they are situated in the rural area like Maruti, the Tata Motors, that Colgate and other companies that they are in the rural area, they are running very well, and gradually the confidence of this company owners as well as among the laborers, it is going on. And government is also now trying to give optimum facilities to them. Government is always having the meeting with the association of these companies and the factories, GCCI, Gujarat Chamber of Commerce, as well as the GIDC, and they have some issues. Study that I did meeting with this association, they have raised few issues regarding regarding their insurance of these workers, regarding their movement of laborers, regarding their transfer of laborers from Dahod, from the other districts also. So few issues are still there, and government has given enough, I mean, confidence to them that will resolve this issue. You can start, you should continue the production. And the second also, let us suppose the full-fledged productions they will do. So similar, definitely they have their issues in their mind that from where we can find the market and from where we can sell our product. So they are having that kind of this issues in their mind, but gradually I think they will be able to solve it when the all links that will be connected, and when all states they will start all these kinds of the all factories, so the supply chain will become smooth. And from where we can get the raw material, from where we can sell our finished products, that will be settled down within, I think, few weeks.
So there are a few questions on your screen in the Q&A button, and some of it like you have already mentioned in your answers. But if like there is something which is not yet touched,
Okay.
we can pick from here. There is a question by Harshal. He's asking, how do you manage the sanitization of supplies which are being distributed to the needy?
Sanitation of
Supplies. I think he's talking about whatever is getting distributed. Is it clean? Is it sanitized or not?
Yes, you can, I mean, have that kind of this confidence that what kind of the supplies that you are getting, the food, first it is the food items. The second, that you can see the pharmaceutical products. The third, that you can say the supply that you are getting regarding the other essential goods. All it is well sanitized, but for the precautions, whatever the food items that you are getting, please wash it properly. Please wash it as per uh, uh, the guidelines that is given to you, or what you are now saying. Let us suppose you are purchasing some green grocery, the green vegetables, then it's better to have the proper wash, the proper, the cleaning of that kind of this food eatable items must be, ensured by you. Because after giving lot of instructions, after checking through our competent authority, so it's better that you can also ensure at your level that nothing, let us suppose if you are purchasing your milk pouch. So when you are now getting the milk pouch, milk inside this pouch is very good, there is no problem. But when you are now purchasing this milk pouch, it is now coming through different shops and different hands and everything. So it's my advice that when you will purchase this kind of this items, then first you wash it properly, then you use it, so that there would be no possibility of infection, there would be no possibility of any kind of the problems that we can have in future.
Okay. There's a question around challenges in supply of essential items uh, in lockdown situation, and what is the emphasis on safety of ground workers in Ahmedabad?
Which workers?
Ground workers.
Ground workers, yes. The first thing that I have told you earlier, that we had given enough safety, we have given enough confidence, we have given enough, the guidelines to our essential commodities and essential commodities producers or the manufacturers. The first, I'll let you know about the pharmaceutical products. The companies like Cadila, it's a big, the pharmaceutical company, Entas and others. With the minimum staffs also, they had continued their production and the supply also. The second thing, we have a good tie-up with the green grocers. We had very good tie-up with the food grain market shopkeepers, as well as the wholesalers, the truckers, as well as chemist shop. So we had conducted series of meeting with them so that they can't have that kind of this fear of lockdown in their mind. Many, I mean, a few organizations, they had raised the issues about the related to the police. So we have also coordinated with the police personals that what kind of, I mean, the problems that you are now facing. So the senior police officers, they had taken also rounds and rounds of meeting to percolate the informations, percolate the guidelines, percolate the orders that had been, given by the governments. And finally, that we are in this position that nobody can say that I have any kind of this problem regarding the supply of essentials. In fact, the permissions that are needed to give to the suppliers, it had given through the digital platforms. Nobody is supposed to come to the collector office or the others office. Whosoever they are eligible, they have got the permissions in their user ID without coming to the any government offices. Apart from that, we had the control this we can say the this many phone numbers that we have circulated so that they can call on this number. Being a district magistrate, we are also getting more than 300 calls, and we are always trying to receive those calls. If we were in the meeting, then we generally, I mean, trying to get the message from the callers that if you have any problems, please message me so that after this meeting or after my free time, I can reply you back. So that kind of this supply chain that we have ensured to be very, very smooth. There would be no problems from any at the production level, at the supplier level, or the purchaser level also, because the customers, they were in lockdown. In fact, we have started the mobile ATM also, so that there would be no problem of the cash our people will face. And at the same time, we have also provided lot of online medical doctors counseling facilities also. Let us suppose if they have any kind of medical problems, they can, without going to the hospital, they can call their doctors. They will get the reply also. And the many 104 1100 numbers are also working 24 hours, so that people will get all kinds of this facility. In fact, the 108 is working always 24 hours. Right now also it is working more than 24 hours, that we can say. So at every point of time, either it is the medical emergency, either it is the supply side problems, or informations also, or the permissions also, production also, supply also. So all kind of I mean the problems that we have sorted out. Huh. We can't say that it is 100%, because many expectations, many I mean citizens, that they have the expectations more than that. But in the lockdown, whatever the maximum that we are supposed to do, we did it, and government has provided maximum facility to our citizens, maximum facilities to our needy persons, as we are now saying. In fact, the widow, as they are also getting the pensions regularly through the post office. The beggars house, they are also getting the regular food packets every day. In this lockdown period, we are supplying more than 1 lakh food packets through the district administration, with the help of NGOs, with the help of Seva Bhavi Sanstha and others to the people. And government has provided food grains also under the Anna scheme to the ration card holders, or those who are not having the ration cards. They are the migrants. They are not having that kind of this facility to get it purchased from the shops. So under Anna scheme, those who are migrant laborers, they are not having the ration card. Government has provided food grains to them also. So that kind of the supply system, district administration has took care of all.
So, there is a question regarding that uh, in Ahmedabad, it's like community spread के level पर जा चुका है ये
Yes.
कोरोना. So कुछ और स्टेट्स में पैरामिलिट्री हैज बीन डिप्लॉयड, सो ऐसी कोई नीड वहां पर है क्या अहमदाबाद में?
अहमदाबाद में एक्चुअली जो ओल्ड अहमदाबाद है, जहाँ पर ये वर्ल्ड सिटी है, जहाँ की पॉपुलेशन काफी डेंस है और people are staying in a very minimum space that we can say. Uh, Police is doing very good job, and we have the curfew also. But the regular police is now controlling it well. People are cooperating also, and at present we don't think any paramilitary forces are required in this Ahmedabad district, and our district administrations is confident that we can control through this present forces.
Ahmedabad Smart City has a command and control center developed under the Smart City initiative. So is that being used? Yeah.
Yes, obviously. The first thing that I have narrated you that during the permission, because being a big district, if the person who is trying to get the permissions, if they will try to come to Ahmedabad collector office, so we can understand the the crowd or the level of social distancing we can maintain. So we have given the digital platform to them. They can apply through any place, and they can get the permissions in their home also. Means there is no delivery system, there is no courier system. Online permissions, it is the first thing. The second thing is that the social media, that the way that AMC or the other organizations they have used, this is also one kind of the sign that many people or almost all people, they got all kinds of this information through the social media platform. The third thing that we can say, that we can say the symptom of the smart cities, because the Ahmedabad has done great job to moving towards the smartness of this city in all sense. And because of this technology that they had given a lot of contribution to combating against the coronavirus. And through this technological support, in fact the citizens, they have they connected to the district administration, municipal corporations, police organizations, and all kinds of this NGOs also, because many NGOs that they have done wonderful job because of this technology, because of this digital city that we can say. In fact, a smart city concept is, can't say that once the any city become a smart, then whole things that had been converted into or translated into the a smartness. Many things that is still, it is needed to improve, and will definitely moving in this path to provide that kind of this platform to all. In fact, the people's participation, the contribution and the willingness is very very required, very very needed to make any city smart in terms of their cleanliness, in terms of their communication, in terms of their all kinds of this public facility that is needed.
Sir, there is a question by Rajendra that there are many crowded cities across India, but how come Ahmedabad has become the most affected city?
Yes, I think this question is very pertinent, and the old Ahmedabad's the world city is definitely very very crowded, and many initially I can say that the persons that like the Tablighi and the other who came from the abroad into the city, and they were not decipher their, or they have not disclosed their travel history before the government officials. And because of all this it was little late to diagnose that kind of this problems inside this city. The first thing. The second thing is that because when the the people who are staying, because earlier there was the stigma that we don't have that kind of this problem, or we could not having that kind of this infections, that had also given a lot of anxiety, or lot of rate of infection among the this dense area in the world city. And the third thing that we can say that the people who are staying in this old city inside this, they were not willing to cooperate with the administration. It was also we have recorded few cases. But when the district administration, municipal corporations, that they had decided to do that kind of this maximum sample, maximum doing the sampling. So the first the cluster containment, the Ahmedabad has started the imposing curfew, and they have started to get maximum number of sample, that is more than that at any part of the Indian city, that we can say. And now the situations, we can say that, oh, okay, it's fine that it is not too late to take the precautionary measure against this infection, and we are taking it, and I hope that will control all these situations very, very soon.
Sir, one question regarding economic impact of the disaster, and what is the timeline expected for the COVID-19 event? Vadodara se sawal hai.
Yes, very complicated and very complex, because the economy is dependent on so many factors. There are so many variables on which the economy or the GDP that is dependent. The first thing is that when we were in the lockdown situations, if our activities, economic activities, are almost become zero, so definitely our this health of this economy of our country will affect, will be affected. The second thing that we can say, our first priority is to combat against this corona. And the priority is right now to fight against corona. So definitely economy, the other activities that we had put in the second priority. But right now government has taken a very bold decisions, that they will start the companies. We have started, we have given the permissions to operate all kinds of these companies in the rural area. Life will gradually come on the normalcy, and the other economic activities will also pick up very, very soon. And we are very, very hopeful that our economy will again reach up to that place. Maybe be little late, but definitely will reach up to that place, because our priority right now is to fight against corona, and to win over it.
Sir, I think you answered almost all of the points here, and many of the questions are repeated, so no point asking that. So with this, we can close the session, and before we do that, I will, Nirala ji, you have attended some of our conferences, seen our magazines, and also here you are interacting with us on the webinar. Elets has been trying to create awareness about the various innovative activities in the government sector and various other sectors, education, health, and banking and finance, and many others. Your opinion about our work and any suggestion for making it better?
Yeah. One thing that we can, have a very humble suggestions, because now
Sir.
the priority of our society and the government is to come over this virus infection. So with your platforms, whatever the contacts, whatever the potentials, whatever the the people who are connected with your system, my humble request is to convey that kind of this message, that maximum possible do the awareness regarding this virus, coronavirus, to our people, so that we can fight together against this corona, and will win, or will come over that kind of the circumstances. The second thing that I would like to request through your channel, regarding whatever the magazines, or whatever the websites, or whatever the social media that you are using, or whatever the good people that is associated, that are associated with you, please request them that few minutes of their busy schedule they can also devote to aware our people regarding this. I think that will make a difference, or people will definitely, generate that kind of this confidence to fight against Corona. That's it.
Sure. So with this, we thank you, Nirala ji, and I thank all the audience on Zoom and on Facebook who are with us. And I will request each of you to please like and share this video and spread the positive steps which Ahmedabad district administration is taking to combat Corona. They are doing a great job. They are fighting for us in the field every day, the whole district administration, and we need to encourage them and support them in this hour of need. So with this, I thank you all and namaskar to all of you. Namaskar.
Thank you. Namaskar.
Thank you.